heart, the human heart is a 4-chambered heart. And part of this is stuff that we'll go over in lecture as well. But the stuff, the anatomy part that I've already gone over, I'm gonna go blazing fast in class because we already have such a short amount of time for this unit in general. Now the anatomy of the heart is fairly easy. We have a 4-chambered heart. Now you have to know the anterior from the posterior. The anterior side, you will have these 2 ear-like structures called the auricles. So you know that this is the anterior. So therefore, this is the right auricle. This would be the what? Left auricle. So we're looking at it like this. Right auricle, left auricle. So whatever side the auricles are on is your anterior side, right? Now let's flip to the posterior side. The posterior side, you can clearly see the trachea, the carina, and the trachealis muscle. So that is how you know the anterior from the posterior side, because you have your auricles and in the front, and you have your trachea in the back. So now let's go over some front or anterior side structures. You already know that this is the right auricle. What is this?
Left auricle.
Left auricle. Now this structure right here, you know that the heart sits in a subcavity within the mediastinum. What is that subcavity exclusively for the heart?
The pericardium.
Pericardial cavity. So what you're seeing here is the visceral pericardium. Where would the parietal pericardium be? Are you seeing it here?
No.
It'd be on the outside. So you dissect, you remove the parietal pericardium. So what you're seeing here is the visceral pericardium here in the yellow. In the heart, this is the apex. So what would it be? What would this be? Base. So this is the base, this is the apex. Right auricle, left auricle on the anterior side. Now, let's open the heart up. Now, the heart is 4-chambered. The right side of the heart gets deoxygenated blood versus the left side of the heart always has oxygenated blood. Now, the 2 upper chambers are called atria. So that's how you know the atrial natriuretic peptide, right? So this is the right atrium. So what would this be?
Left atrium.
Left atrium. Right atrium, left atrium. Now the bottom 2 chambers are called ventricles, and they're bigger than the atrium. We have the right ventricle and we have the left ventricle. Now the trick to finding out the left ventricle is that the walls of the ventricle are the thickest on the left ventricle. Why do you think that is?
Because it has to have that much force to bring it out to
Exactly. So from here, from the left ventricle, blood is gonna go all over your body. Right. So here, in the right ventricle, where's blood gonna go? From here only to the lungs. Exactly. So is everyone crystal clear about the chambers here? Now, the wall here that's separating the 2 ventricles is the interventricular, between the ventricles, interventricular septum, versus this would be the what? Interatrial septum. Interventricular septum, interatrial septum. Now you know that this side of the heart, this is the right side, what kind of blood's gonna be here? Deoxygenated blood. Right here on the left, you're gonna have oxygenated blood. Now take a look at this. Here, blood is getting dumped from this massive tube and from this massive tube. What would this be?
Superior vena cava.
Superior vena cava. and this would be the inferior vena cava. So superior vena cava is bringing blood in from the brain, the neck, and the upper appendages. The inferior vena cava is bringing it from the chest, the thoracic cavity, pelvic cavity, and the lower appendages. So if you see this, it'll open here, and there's the hole right here. Is everyone with me? So from here, there are some more markings on here, right? Now there's this little donut-shaped structure in the interatrial septum, and that is called fossa ovalis. The fossa ovalis is a structure where electrical current can go through and through, because when the depolarization of the heart takes place, it's going to happen by this structure right here. So that brings me to these two green structures. This one here with number 73 is called the SA node, or the sinoatrial node. So when this gets depolarized, the electrical charge is going to go all through those intercalated discs. Remember the intercalated discs? And it's going to flow through the fossa ovalis, and it's going to depolarize your left atrium as well. Now when both the atria get depolarized, they squeeze. Anybody know the word for atrial squeezing or heart squeezing?
It's contraction.
Systole.
Oh, systole.
And what is relaxation?
Diastole.
Diastole. So when the electrical current, action potential, comes from the brain, it comes first to the SA node. From the SA node, it goes through the intercalated discs and it depolarizes both the atria. And as a result of atrial depolarization, what will happen? Atrial systole. Are we good? Now, when atrial systole happens, the atria squeeze. So pressure in the atria will do what? Will the pressure in the atria increase or decrease?
Increase.
Increase, because you know Boyle's law, right? Now from the right atrium, blood is going to go through this little junction over here into the right ventricle. And this little valve right here is called the tricuspid valve. Number 56 here is the tricuspid valve, because you can see the three flaps. 1, 2, and 3. The three flaps. 1, 2, and 3.
Perfect.
Now from here, it goes to the tricuspid valve, and it goes to the where?
Right ventricle.
Right ventricle. Now here in the right ventricle, you'll see these three structures. Now these are chordae tendineae. Now the chordae tendineae are like little strings that are pulling the curtains open, right? So the chordae tendineae is going to pull on the flaps are going to open, and blood is going to go from the atrium to the ventricle. So these right here are chordae tendineae. Now you know that this is made up of collagen. You need a muscle to still do the pulling. So enter this. Structure number 58. This right here is called the papillary muscles. Papillary muscles. So you have tricuspid valve, chordae tendineae, papillary muscles. Now the bottom of the ventricle, you see that there's something that looks like rugae, right? Now those are meant to increase surface area. They are called trabeculae carnae. Anybody have their word bank here and they're checking off these things? And we'll go over this a couple of times. So once slowly, because we're recording.
Do you want me to pause and then start over?
I mean, you can. It'll help because
I can edit it when I get home.
Oh,
Okay.
you can.
Yeah,
Okay.
okay.
You're much better with that than I am. All right. So should we review what we've gone over so far, or continue and then do a review later? Continue. So far we've gone over the tricuspid valve, chordae tendineae. What are these? Papillary muscles. And what are these spiny structures.
Trabeculae,
carnate. Very good. Now, what happens to our depolarization, right? We know the sinoatrial valve. It gets the depolarization travels through the septum and it goes here to structure number 74. This is the interventricular or atrioventricular node. So these two are the pacemakers, guys. So this is the AV node or the AV pacemaker. Now from here, the electrical signal is going to go through this little stringy white structure right here. Now this little stringy white structure here, number 75, is called the bundle of His. Bundle of His. And this bundle of His bifurcates into two. The right branch and the left branch. Who's heard of branch blocks before, right? So they block these if necessary. Now this is the right bundle branch, this is the left bundle branch. And then they wrap around the apex of the heart and then they bifurcate and branch out into these little white gray fibers. Now those are called Purkinje fibers. So that is how the depolarization is getting to the ventricular walls, is by the Purkinje fibers. So to begin the process, what is getting depolarized first?
SA node.
SA node gets depolarized, then it goes through the intercalated discs of the heart muscle, and it does what to the atria?
Systole.
It first depolarizes.
Oh, depolarizes.
After depolarization comes
Systole.
atrial systole.
Okay.
By then, the signal has reached the
AV node.
AV node. Once the signal reaches the AV node, should the atria remain contracted? No. So what will happen to the atria? Atrial diastole. The depolarization will then go through the structure, which is bundle of His, and then go down the right and left bundle branches. From here, they will wrap around and go through the what? Purkinje fibers, and then they will cause ventricular depolarization. In response to the ventricular depolarization, what will the ventricles do? Systole. So that's when ventricular systole takes place. Now, when ventricular systole takes place, blood from the right ventricle, remember, this is all deoxygenated blood. Ideally, you shouldn't have any mixing. So from the right side, this is the right side, right? From here, it's going to go through this blue tube, through this valve right here. So valve number 63 is called the pulmonary, because this is going to be your pulmonary, what? Artery or vein?
Artery.
Artery. Very, very good. So number 10 is your pulmonary artery. And this valve here that opens up from the right ventricle, this is the pulmonary semilunar valve. It's half moon shaped. So number 63 is the pulmonary semilunar valve. So it's like this. When this contracts, blood is going through here. From there, it's getting pushed through the semilunar valve into here. And then this right here, this will not stay together. This is called the pulmonary trunk, guys.
Okay.
And it bifurcates into two things, the left and the right pulmonary arteries. Is that making sense for everybody? So this is the pulmonary trunk. This is the what? Pulmonary semilunar valve. And if you see blue tube opening up through the ventricle, which chamber is this?
Right ventricle.
Right ventricle. Is that making sense for everyone?